What are the 20 main symptoms of Asperger syndrome?
Hello, my name is Luc Martrenchar. I'm a clinical psychologist and I specialize in the detection of intellectual giftedness, Asperger syndrome, and ADHD. And I created the website bilanpsychologique.com, which is in English and in French.
And in this video, I'm going to present the 20 signs that a person has Asperger's syndrome. To discover if you have Asperger syndrome, the first step is the Asperger syndrome screening test. You'll find it in the description. It determines the probability that you have Asperger syndrome and it gives advice on what to do next. And then to get a diagnosis of Asperger syndrome, a full psychological evaluation is needed. Today, Asperger syndrome is considered as one of the autism spectrum disorders, according to the DSM-5-TR, which is the main international classification of mental disorders. And its particularity is that it's without intellectual impairment and without language impairment. Every of these 20 symptoms comes from international classifications and from the tests that have the highest validity when it comes to diagnosing Asperger's syndrome. So while I describe these 20 symptoms, keep in mind that they can be currently present or they can have been present in the past. Also, keep in mind that every person with Asperger's syndrome is absolutely unique and it's very rare to have all these 20 symptoms at the same time. Usually it's between 10 and 16 to 18. How many of these 20 characteristics do you have? Share the number of signs that you have now or that you had in the past in the comment section. First sign of Asperger's syndrome, sensory hypersensitivity. That means being oversensitive to things in your environment. You might overrespond to some foods, some noises, light, some smells, some fabrics, or textures. That means that some of them might be extremely disagreeable for you. It might surprise you, but the opposite is also true. Sensory hyposensitivity is also a sign of Asperger syndrome. That means a hyporeactivity to sensory input. For example, not reacting at all to pain, to hunger, to temperatures, to some scents, or some flavors. So the third sign of Asperger's syndrome is resistance to change, and can even be an intense distress when some changes occur. And I'm even talking about minor changes. For example, not being able to eat the same food every day, not being able to dress the same way every day, or not being able to take the same route to go to their workplace as usual. And they have this difficulty with transitions. Fourth sign of Asperger syndrome, routines. There's usually an insistence on sameness and even rituals, such as greeting rituals, a way to greet other people, which is very personal and original. But it can also be a very ritualized life from the moment they come back from their work to the moment they go to sleep, for example. And there's a tendency to plan everything. They usually like to know how things are going to play out in advance. Fifth sign of Asperger syndrome, rigid thinking patterns. So that means a difficulty to adapt to novel situations and to people they do not know very well. For example, if someone new comes to work with them in their workplace, it can be very distressing, they don't like it. Or if their usual dentist is replaced by someone else for the consultation, it can be also distressing. Also, they follow rules and they rarely cheat. And it can be difficult for them to be diplomatic. When they tell things, they will tell the truth, even if it hurts other people. Sixth sign of Asperger syndrome, restricted interests. Their interest can be highly restricted and fixated, and also unusual in their intensity or focus. That also means that they can be complete experts in one specific field. Seventh sign of Asperger syndrome, unusual interests. Some people with Asperger syndrome may have a high interest for something that's very narrow and very out of the ordinary. For example, knowing everything about the different types of batteries, knowing everything about one specific insect or one specific TV show, etc. In the show Atypical, for example, Sam is obsessed with Antarctica and penguins and will freely tell people all about his favorite subjects. So the eighth sign of Asperger syndrome is repetitive movements. Repetitive motor movements or repetitive use of objects. For example, lining up toys instead of playing with them or flipping objects again and again. It can also be finger flicking, hand flapping, and rocking back and forth while sitting or standing. So the ninth sign of Asperger syndrome is repetitive speech. That means repeating the same things over and over again, and also repeating what other people are saying, which is commonly referred to as echolalia. And they can also have their own language. They can invent their own language. So the 10th sign of Asperger syndrome is the difficulty making friends. They can have a hard time creating friendships and maintaining friendships and also understanding relationships overall. But in childhood, they can have one good friend who can also be on the spectrum, or someone who's not on the spectrum and that they will imitate in order to hide their difference. The reason why some people with Asperger syndrome do not have any friends or have very few friends can be because they have a hard time understanding relationships, but it can also be because of a lack of interest for other people or even a complete absence of interest in their peers. And the 12th sign of Asperger syndrome is this difficulty with social interaction, a difficulty adjusting their behavior to suit various social contexts. And usually when they were children, people with Asperger syndrome faced difficulties in generated pretend play acts spontaneously during free play. For example, it was difficult for them to pretend to be a doctor or a policeman or a teacher. So the 13th sign of Asperger syndrome is this difficulty with nonverbal communication. In fact, usually their nonverbal communication does not match their verbal communication. And sometimes it can even be a complete lack of facial expressions and a complete lack of nonverbal communication. And the 14th sign of Asperger syndrome is this difficulty understanding non-verbal cues. They usually have a hard time reading emotion in facial cues and in body language. So that will lead to awkward situations where they will think that the person they're talking to is sad, intensely sad, when in fact they're just surprised, or that they're happy when in fact they're very stressed. So their behavior will not be adapted to the situation. The 15th sign of Asperger syndrome is differences in eye contact. So when people think about Asperger syndrome, usually they think of this tendency to avoid eye contact, to look at the mouth instead of looking at the eyes. but it can also be other kinds of differences in eye contact. For example, a tendency to stare intensely at others as if their gaze was going through the person. So conversation is the 16th sign of Asperger syndrome. They usually find it difficult to have a normal conversation, in particular when they're on the phone, not knowing when to listen to the other person and not knowing when to speak. And so that can lead to moments when they interrupt the other person and moments when they don't speak when the other person is waiting for them to speak. The 17th sign of Asperger syndrome is reduced sharing of emotions. As a psychologist, when I receive someone in my office for an assessment, or when I do online sessions to determine if a person has Asperger syndrome, I always ask questions about the present, but also about the past, because you can have some people who had a real difficulty sharing their emotions when they were children, but then they learned to do it with time. The 18th characteristic is a difficulty approaching other people, initiating interactions with them. Usually people with Asperger syndrome do not really know what to say, how to behave, how to make the other person interested. And also when someone else initiates an interaction with them, it can be difficult for them to know how to respond to it. So the 19th sign of Asperger syndrome is the absence of speech delay. Asperger syndrome is a form of autism spectrum disorder without speech delay and without speech alteration. So that means that their first words appear at the latest at 2 years old, and the first sentences appear at the latest at 3 years old. The last sign of Asperger syndrome is the absence of cognitive delay. It's a form of ASD without intellectual impairment. There is no intellectual handicap in Asperger syndrome. So overall, how many of these 20 characteristics do you have? Share your experience in the comment section. If you have at least 10 of these characteristics, the first step to discover if you have Asperger syndrome is the Asperger syndrome screening test. You'll find it in the description. It can also be used for people you know very well, such as your children. It is a way to begin discovering why you have felt so different for so long. So that's it for this video. If you liked it, please give it a like and subscribe for more videos on this topic. See you soon.